Hi, it's me, Ingrid FP, and welcome to part 5 of this medical series. I was at the cardiology, the heart-lung days in Stockholm with a lot of lectures about different topics, and this topic is about hormones and heart-lung disease. Cardiovascular disease. And this one is about the first lecture out of the 3 in the series is about pregnancy. If you have pre-eclampsia, meaning that you have high blood pressure during your pregnancy, after week 20 from your pregnancy, with an organ that is also affected by this. It's often the placenta, but it could be other parts of your body. If you just have high blood pressure, then it's not preeclampsia. That just means that you have pregnancy hypertension, basically. And having preeclampsia when you're pregnant is a risk factor for developing heart-lung disease, cardiovascular disease later on in life. And that is a risk factor in itself. And it's not dependent on other risk factors. And preeclampsia is very dangerous for mother and baby, because it leads to ischemia, basically no blood flow in the placenta. But this can also have consequences long-term for the mother. Another pregnancy complication that can lead to problems, cardiovascular problems, is if you have a baby with intrauterine growth problems, so like very, very small babies that are born. That means that something is not really great in the blood flow, and that means that something in your blood vessels is not going completely right. We don't always know why. And having babies that are prematurely born before week 37 have a higher risk, like people who have a lot of babies basically that are premature, and we don't know that they have any other like problems in their vessels, often get cardiovascular problems later on, as opposed to if they only had babies that were like healthy, born on time, completely normal weight, and they didn't have preeclampsia. 1/5 of all pregnancies have a sort of complication in that form. It could also be, one of the other ones is, diabetes, pregnancy diabetes. Pregnancy diabetes is if you have a glucose over 5.1 if you are fasting, and if you drink a lot of glucose, they make you drink a lot of glucose. If it's over 10 after an hour, then you also have like pregnancy diabetes. These women need to be followed up quite a lot after their pregnancy. It's interesting because pregnancy is kind of like it's a huge test of your body's capabilities. It puts a huge press, a stress on your whole body. It affects how much you need to eat and how much your heart can handle, and because the circulation changes and your hormones change and your the capacities for different things change, and it's very interesting. So that was that about pregnancy. But it's important to like check if there's going to be problems later on, basically. Then we have this personality. She is often on TV and often in the newspaper and stuff. I've met her, or I've seen her in as a lecturer at my university, and she's a hardcore feminist, basically, and she is very much for a surrogate mother, which I don't really know what I think about, but she basically is a man hater. Okay. Helena Kopp Kallner. She's kind of a special person. So, and she's very into contraceptives, like the pill, contraceptive pill for women. And she says that it's, according to her and according to the studies that she's looked at, it does not really give the risk for blood clots, according to her. Now, I don't know, I have heard the opposite, but who knows. She said that the pill maybe, but not IUD, hormonal IUDs, do not give a higher risk for thrombosis, and that I'll gladly accept, because like I understand how that could be true. And the transdermal like patches and stuff for menopause and stuff also doesn't give a thrombosis risk. Also, when you take anti-conception, this one I also believe, during the actual treatment, you might develop breast cancer. But after you have stopped the treatment, then everything returns to normal, and basically you are actually protected from getting breast cancer or other kinds of cancers. Because the estrogen levels are kind of like everything has returned to a baseline, kind of. That's kind of how I figured it out. I'm not going to go more into it because I'm not really sure about everything that she said. Then there was about hormonal treatment for men. And this is about men who went testosterone. And a lot of men come to me as a doctor and say, I want testosterone. I am low on testosterone. I need more testosterone. Can you please prescribe me a testosterone pill? I'm like, okay, I don't want to, like, why? Anyway, so there is this thing called hypogonadism, which is basically if you have a low testosterone and you have symptoms, okay? And with symptoms, it means that you have gynecomastia, your breasts are getting bigger, you have small testicles, you have lower libido, but lower libido in itself is not enough to like count as a symptom. You need to have like several of these things. Osteoporosis, if you have a lot of sweats like as if you were a woman going through menopause, basically. Or if you have an anemia, then that means that it could be worth taking a testosterone test to check if your levels are okay. Taking testosterone test is not always the best thing to do, because it's not the best thing to do if you just have erectile dysfunction, because it's often because of other things. If you have an isolated, just the libido is down, because it's usually not just because of testosterone. If you have a normal hemoglobin and don't have an anemia, if you're just doing a routine control, it's not useful. Or if you have gone to the gym and you haven't got enough effect from that, unfortunately, that does not mean that you are ill, okay? Not in itself. But if a person is muscular and say that they have a testosterone problem, then like, you know, something is not quite right here either. So don't take a testosterone test. And also, then in the treatment is testosterone. You shouldn't give testosterone if your testosterone is over 7, 8. What happens is that we cannot tell what the problems of a long-term use of these medications can give. And at the moment, it seems that it can give a negative impact on your cardiovascular disease. So everybody kind of feels better from getting a testosterone. You know, like you feel stronger, you feel more more positive and such. But that's also the case of like taking, you know, amphetamines or taking cortisone, which is actually something that we prescribe. Everybody feels more happy on cortisone and feels like they are full of energy with cortisone, basically. But that doesn't mean that you had a problem to begin with. It doesn't mean that, oh, the testosterone is working, so I had low testosterone, that's why I needed more. You maybe weren't ill to start with, or maybe you had some other illness that has nothing to do with testosterone. So and the reason why we are careful is because of the cardiovascular complications. Also, there are quite a few problems with testosterone, the blood sample that we take for it. Basically, you can only take it between 7 and 10 a.m. in the morning, because that's when the testosterone is at its highest. Or no, it is at its highest, I think. I need to check that one. And also, you need to take it at least twice because it changes throughout time. And also, it depends on how much is bound to other molecules. And one person who has high testosterone in this blood sample might actually have less testosterone than somebody else who has like a lower actual result. So that makes everything very, very confusing. So yeah, that's what they had to tell about that. Okay, and so the next video will be about diabetes type 2 and the new guidelines, the European guidelines. So tell me what you guys think. I know that nobody is watching these videos, but yeah, have a great day. Bye.